The continuation of the theories to quality management, I included here also the total quality management, which is this quality assurance theory emphasizes on product quality. The definition of TQM is a management approach to long-term success by satisfying customers. According to this concept, all the members of an organization contribute towards the improvement of products, processes, and services, thereby improving their working culture. Next is the continuous or improvement by Kaizen. This philosophy stresses a constant improvement through the right mindset and attitude. Kaizen is a Japanese term for a continuous improvement. Kaizen means Kai equals change, Zen equals good or good change, which is achieved through improvement of little things and setting and achieving higher standards. And lastly is just in time or GIT. This method focuses on reducing resources and therefore cost. Henry Ford described the GIT concept in his 1923 book, My Life and Work. GIT works on demand pull basis, which means production starts when the orders are received. The actual orders dictate the production and quantity. GIT works in coordination with TQM and continuous improvement as it requires proper planning for a project to be a success. Advanced technology is mandate for GIT to provide backup with production scheduling and fulfillment of orders. Next is the definition of definition of terms and examples applied in the nursing department or organization. First is quality. Quality means doing the right things or meeting the customer's need in a way that exceeds the customer's expectations. Another definition for this, it can be said to be at least in part of compliance standards. Like for example, the quality of a nurses must you know that nurses play vital role in today's healthcare system. They are quick to meet the needs of their patients with exceptional care. Not only they do possess expertise acquired through a nursing degree program, but they also have other qualities that contribute to their professional success. Um, like um, like the a good nurse must be a hardworking, which is one of the qualities of good nurses is willingness to put in the hard work and takes to meet their goals. At times, lengthy shifts spent on one's feet make this career physically demanding. Yet, fueled by their passion and desire to help others, exceptional nurses put in the necessary effort. Another quality example for nurses are they must possess extensive knowledge to care effectively for their patients, or shall we say, they are knowledgeable. For example, they must have an in-depth understanding of the subjects such as human anatomy, microbiology, and pathophysiology. In addition, they must have the skills to apply healthcare theories in real life situations. Another is nursing is a professional career that requires specific medical knowledge or uh, curiosity. I mean, they are curious. The medical field changes rapidly, and new protocols and constantly being implemented for patient health and safety. Nurses learn the basics during the degree programs, but they continue to learn while on the job. Continuing education is crucial for all health workers. They can become advanced practitioners and industry leaders by earning a master's of science in nursing. Another quality example is being an effective communicator, because uh, a good nurse must have a strong communication skills in the workplace. Nurses must be able to communicate clearly with their coworkers and with patients and their families. They must be able to take instructions from coworkers and supervisors, especially in high pressure situations. They must also communicate effectively with patients and their families to meet their needs and provide quality care. Also, nurses must bring optimistic attitude to their job so that they can so that they can see the bright side of situations and encourage their patients who are on the road to recovery. While this career may be emotionally challenging at times, outstanding nurses know how to remain positive and focus on serving others. Another is being compassionate, one of the most important qualities where nurses will see patients soft, in their career, nurses will see patients suffer. Beyond simply offering a solution, they must be able to express compassion for patients and their families. This allows them to form meaningful relationships with their patients. Another also is nurses must be empathetic and try to understand things from the patient's points of view. Empathy can shown to patients in many ways. Nurses can listen to patient concerns without interrupting or questioning what patients think might be causing their illness. For some, empathy can be as simple or being told what to expect during a treatment process. Another is even tempered, being flexible, like kanang being calm when remaining being calm even under pressure will also help nurses to stay flexible, detailed orient detailed oriented, and also critical thinker. And the next is the quality care, which is a degree to which nursing services to healthcare consumers, families, group communities, and populations increase the likelihood of desirable outcomes and are consistent with evolving knowledge. To make sure that health services provide quality care that improves people's health, care should be effective, safe, people centered, and timely. Oh, in order for the quality of care to be effective, for example, to be safe, for example, like avoiding harm to patients during their medical treatment. And also, in order for the quality of care to be effective, example for that is providing medical services to patients who could benefit from them and avoiding the use of services that are unlikely to result in better patient outcomes. And also, in order for the quality of care to be timely, for example, reducing wait times and delays for appointments and treatments. Next is the quality assurance, which means maintaining a high quality of healthcare by constantly measuring the effectiveness of the organizations that provide it. It is a way also of preventing mistakes and defects, for example, in manufactured products, and avoiding problems while delivering solutions to the consumers. Example of this is that maybe an organization can create a steering committee. Like steering committees will going to evaluate the current policies, procedures, review applicable regulations, recommend changes, make suggestions about the reporting procedures, and etc. And next is example is to spread news. No matter how the organization, like during what happened during the departmental meetings, for example, emails, flyers, information, or hospital internet, etc. Uh, no matter how you share during the department meetings, for example, we have to make sure that employees understand the reasons why quality assurance is crucial, even if you've already explained the importance of patient satisfaction scores multiple times. It is a good idea to provide several examples of the ways employees' actions that affect the experience. The organization can also evaluate results by reviewing information and input provided by patients, their families, and staff. In addition to taking a look of the performance indicators, will help you ensure your quality assurance program produces results and the benchmarks and targets are met. And also, like for example, the organization will make implement corrective strategies. Next is next slide, ma'am. Next slide, ma'am, please. uh, Next is the quality improvement. It is the framework used to systematically improve care. Quality improvement seeks to standardize processes and structure to reduce variation, achieve predictable results, and improve outcomes for patients, healthcare system, and organizations. Structure includes things like example technology, culture, leadership, and physical capital. Processes includes knowledge capital. Example, the organization can use standard operating procedures, or human capital, for example, education and training. Next is the quality improvement plans, or the QIP. It is a formal, documented set of commitments that a healthcare organization makes to its patients, clients, residents, staff, and community to improve quality through focused targets and actions. Example of this Example of these are an organization will make QIP on how they on how to in the reduction in the medical related adverse events, on the optimization of sepsis care, on the decreased number of urinary catheter infections, reduce hospital readmissions, decrease medical administration errors, or on how or making QIP on how to improve electronic medical record documentation. Next is the indicators. It is a specific, observable, and measurable characteristic that can be used to show changes or progress a program is making toward achieving a specific outcome. Examples includes indicator traces, the percentage of patients seen according to the number of beds available, or the occupancy rate, the total interval or the average length stay of the patients in a given period, or the patient satisfaction. Uh, Next is the sentinel events. It is an unexpected occurrence involving death or serious physical or psychological injury, or the risk thereof. Serious injury specifically includes loss of limb or functions. Examples are the most common sentinel events are wrong side surgery, foreign body retention, and falls, then followed by some suicide, delay in treatment, and medication errors. Next slide. Next is benchmarking, something that serves as a standard by which others may be measured or judged, a point of reference from which measurements may be made, or a standardized problem or test that serves as a basis for evaluation or comparison, as of computer system performance. For example, a leader may compare the patient satisfaction rates across the emergency, cardiology, intensive care unit, and neurology departments of the hospital to ensure consistent care and service for the patients. They may also study metrics such as 30-day readmission rates, average length stay of the patient in the hospital, patient drug cost per stay, and hospital acquired condition rates. Next is for the best practice. It is our health practices, methods, interventions, procedures, or techniques based on high quality evidence in order to obtain improved patient and health outcomes. Examples are how to curb infection spread, how to identify patients correctly, use medicine safely, avoiding surgical errors, customize hospital charges, or foster an open communication culture. Next is for the quality management. It is an act overseeing all activities and tasks that must be accomplished to maintain a desired level of excellence. This includes the determination of a quality policy, creating and implementing quality planning, and assuring and a quality control and a quality improvement. So here is an example. A trauma hospital offers a service to safely and efficiently assess and stabilize a patient after suffering a traumatic injury. Regardless of the patient's history or background, the patient is seen with a specific time frame based on the acuity of the trauma. To achieve optimal care, all trauma providers are all trained in advanced trauma life support to keep the evaluation of this patient organized and address the most life-threatening injuries. Despite the intensity of the trauma scenario, all efforts need to respect a patient's privacy and goals of care. After the patient's hospital stay, quality management teams measure data, including adverse events, patient's outcomes, and experience to optimize future care and make changes and recommendations as needed. Next is for the total quality management. It is an ongoing process of detecting and reducing or eliminating errors. The focus is to improve the quality of an organization outputs, including goods and services, through the continual improvement of internal practices. It is an integrated process involving systems and employees in a continuous effort to improve quality, reduce costs, and enhance service to customer. To identify essential elements of TQM, among in the healthcare, one example on these are researchers conducted a meta-analysis to determine crucial aspects to the success of TQM in healthcare. Among these were leadership, employee involvement, training, process management, support from upper administration, and planning. Interestingly, another meta-analysis identified factors contributing to the failure of TQM implementation in healthcare. These include lack of employee involvement, specifically by physician lack of consistent upper management support, poor leadership, lack of quality-oriented culture, insufficient education and training, and inadequate resources. Next slide. And another definition, another is for the definition of effectiveness. It is a capability of producing a desired result or the ability to produce desired output. When something is deemed effective, it means it has intended or expected outcome or produces a deep, vivid impression. Example on this is the effectiveness of the drug use or how the drug works, or are there any interactions with the other medications or interactions with the health conditions of the patient, and also how effective communication can save the lives of a patient uh, in when by showing rapport or trust to avoid mistrust, communication, or unnecessary injuries. Next is efficiency. It refers to the peak level of performance that uses the least amount of inputs to achieve the highest amount of output. Efficiency requires reducing the number of unnecessary sources used to produce a given output, including personal time and energy. For example, through fewer medical errors, more appropriate medication, and less rehospitalization, cost efficient and cost effectiveness will be enhanced as well to the degree that this leads to the higher workforce productivity. Next is continuous quality improvement involves the systematic use of tools and processes to identify and analyze strengths and barriers within an organization and continually test and improve outcomes. For example, implementation of CQI in programs in colonoscopy services found a significant knowledge gap concerning barriers and facilitators pertaining to nurses, patients, and managers. Next is continual improvement. Continuous improvement, sometimes called as continual improvement, is the ongoing improvement of products, services, processes through incremental and breakthrough improvements. These efforts can seek incremental improvement over time or breakthrough improvement at all times. Examples include streamlined clinical care processes, reduce treatment variability, how to reduce costs for both providers and patients, um, help hospitals meet regulatory requirements, or how to improve the quality of customer service for patients and their families. Next is the rapid cycling test. It is a quality improvement method identif- that identifies, implements, and measures changes made to improve a process or a system. Example on this is the way to conduct plan, do, study, act, or using the PDSA cycles, wherein a PDSA cycle turns into a change idea and action. In a in a PDSA cycle, the goal is to test a particular change in the small scale, learn what you can and better in the next application. Next is Lastly is the risk management. It is a complex set of clinical and administrative systems, processes, procedures, and reporting structures designed to detect, monitor, assess, mitigate, and prevent risk to patients. Examples are not filling expired prescriptions to prevent abuse, following up on missing test results to increase consultations, tracking missed appointments to manage risk, increasing communication with patients to reduce improper taking of medication, and preventing falls and immobility.